Mrs. Roberts. I am your instructor for RNSG 2910 Maternal Child Nursing. I'm going to be going over Module 1. As you can see, I have my PowerPoint pulled up, and then I also have my ebook, the Davis Advantage ebook. It is Maternal Child Nursing Care, 3rd edition, Scannell and Ruggiero from F.A. Davis or Davis Advantage. And then you'll see my PowerPoint over here. Chapter 1 through 4 go pretty quickly, and then I'll slow down when it comes to chapters 5 and 6. If you have not heard, I use a lot of what I call wink and lollipops. That is just a term that I use to get your attention and make you understand that this is important information that you will need to know. You can highlight it in your book, take a note down in your book, which will be a great idea when you start studying for the exams. Okay, we're going to start on chapter 1. And you can see my little quote over here that's important to be a good nurse. Chapter 1 is going over core concepts of maternal and pediatric health care across the continuum. It starts by talking about nursing roles, standards of practice, nursing processes, clinical practice guidelines through ANA, and then it shows you the pyramid of evidence, building a relationship with your patient, and then the Maslow's hierarchy. And this is on page 9. It coincides with the page number down here for your book. On page 11, it starts talking about the family unit. In your yellow clinical folder, you will receive or have received a page that has the different types of family units, family models, types of families that will be important for you to use in the clinical setting. Then it starts talking about the different cultures. So we'll go down on page 13 and you'll see the different cultures. You will be doing a cultural presentation at the end of the semester. You'll be in groups, and then the groups will present the different cultures to the class. So we'll talk about that. But for this cultural practice, there's your first wink and lollipop, and that is this right here. So in all care settings, the nurse should use the services of professionals who can interpret word meanings correctly. So we don't try not to use family members if we can help it. We use the employees that are interpreters of the facilities. Relying on family members often result in literal translation of words and omission of information, problems that cause or create confusion and misunderstanding. So in settings where professional interpreters are not available, the use of services such as International Thesaurus or handheld personal information devices can be useful alternatives. And there's 5 bullet points I want you to write down, okay? And this deals with cultural values. Number 1, do we need an interpreter? Number 2, what are we doing for pain management and coping? Number 3, what is their preference for food during labor? Because remember, we're talking about OB and peds, right? Maternal, the maternal client and the pediatric client. So this has to do with the maternal client. Number 4, the preference for touch. And number 5, who is their support person during labor? Then it starts talking about different parenting styles. You can see over here on this slide, it gives you cultural practice for maternal nursing. the Asian American, African American, Hispanic, Native American, and European American, and what they may believe as a culture dealing with maternal nursing. On page 15, it starts talking about the trends in maternal, infant, and child epidemiology, common mortality statistics terms, and then I have some information here that you need to be familiar with. So, leading causes of maternal mortality in the United States include these issues. I want you to add one. I don't have a percentage for it, but it's very important. It's lack of prenatal care. And then it talks about the infant morbidity and mortality and the leading causes. And that is it for chapter 1. We're going to go right into chapter 2. So chapter 2 is reproduction. You just pull it back out of that filing cabinet that you stored it in from Anatomy and Physiology. So there's lots of different terms. Sexual differentiation in the embryo, and you can read through that. Although the sex of an individual is determined at conception, it does take about 8 weeks before the embryo distinguishes the sexual characteristics. So we all start out as a female, and then once the gonads, which is the sex gland, drop out of the torso, a male embryo is formed. If they don't drop, then they are staying a female. So you can read through that. In the male sex, the first primitive gonad regresses, whereas the cortex develops into an ovary at approximately 10 weeks. You have a picture of the mons pubis. This is the external genitalia of a female. So, looking at a live patient, of course, we have our clitoris. The large folds on the outside of the vaginal orifice is the labia majora. The thinner ones on the inside is the labia minora. Then you have the vaginal vault here with different glands. Your perineal tissue, which is the tissue between the bottom of the vaginal opening and the anus, so the perineum, and then your anus. In between here, there is your urethral orifice, so your urethral opening. Okay, so clitoris, urethral opening, vaginal vault opening, and then your anus. The picture over here is just how a baby is sitting in utero. The fetus, this is a vertex fetus, and we'll talk about that later on. Just make sure you understand this uterine anatomy, okay? This is the same picture that's in your book. So, for your uterus, this is our vagina, the vaginal opening. Our cervix is here at the bottom of our uterus. This is the body of the uterus here. Our fundus is the very top of the uterus. Then we have our fallopian tubes and our ovaries to the side. And you'll see how it goes over. And here's another picture of it. Okay. So you have, of course, the cervix, your uterus. This is where the lining is, the implantation happens. So the ovaries produce the eggs. They come up through the fallopian tubes, down into the uterus, where spermatozoa enters, and then it attaches to the uterine wall for pregnancy. This is our bony prominence pelvis of a female. This is on page 30 in your book. Again, a picture of the pelvic floor of the female. The different muscles, urinary meatus here. So you see our clitoris, urinary meatus, vaginal vault, and our anus. On page 32 is showing you different shapes of pelvis. They can vary based on the width of the inlet opening. Okay. An important part of this pelvis that we'll talk about later is our ischial spines, and these are down here. Okay. Our breast tissue. On page 34 is talking about the different 33 and 34, the cycles, the menstrual phase. You have days 1 through 5 where you're actually on the menstrual cycle. Proliferative phase is 6 through 14, and luteal phase is 14 through 28. I don't know if you can see that, but it's just the calendar, kind of like a birth control packet. The oral pills, and you take the ones, and then at the very end they're kind of the placebo. So and then it starts talking about puberty, different types of female reproduction. You can read about that, the FSH and LH levels. Estrogen, progesterone, inhibin, and relaxin. These are the different hormones. The different maturation states of a female. It goes on through just kind of a refresher of your anatomy and physiology. Then it's talking about the male productive organs, sex productive organs, testes, scrotum, epididymis, and epididymitis is if it's swollen. The prepuce and the glans penis, all of this here. This is the picture from in your book. And then different cycles. So let's go to page 45. Types of contraception. Okay. Here. So there's lots of different types. You can see the birth control methods over here as well. And this is just the page that's in your book, that's right here. But the different birth control methods: condom, female condom, the pill, OCP is your oral contraceptive pill, hormonal ring, IUD or UID, injection, which is like your Depo-Provera shot, surgical sterilization, implant like your Nexplanon, coitus interruptus, calendar, rhythm method, patch, and diaphragm. So coitus interruptus is what I call the Greyhound method. You pull out on time. So that's how you can remember that. Lactation amenorrhea. This is somebody that's breastfeeding. They think that breastfeeding stops them from being pregnant, but there are so many women that go back for their 6 weeks exam or 6 months exam and they're pregnant. So that is not true. Let's go back up here and talk about the basal body temperature. This is a wink and lollipop, this box 2-1, so you definitely need to know this, okay? The basal body temp is usually below 98. As ovulation approaches, the estrogen production increases, and then at its peak, when it slightly drops, there's a rise in the basal temperature. So you need to know this, like the LH surges. So make sure you know that, okay? They are, and you might want to write this down, this is also in your book, your ATI book, which is the RN Maternal Newborn Nursing ATI. It's the blue one, on page 4. And it's talking about taking the basal temp every morning before rising. So before they even get out of the bed, they need to have that thermometer there. And they actually make one that's specific, like it might be 98.204. That's really a specific temperature, and that's the one that they need to be using. Okay. And then it's talking about barrier methods, diaphragms, and we talked about this over here, cervical caps, condoms, spermicides, contraceptive sponge, and then hormonal methods, which are your OCPs, okay, oral contraceptive pill. Alright, optimizing outcomes, another wink and lollipop here. So there's some contraindications when you take birth control pills, and you should know this. This is a wink and lollipop, okay? So if you have a patient that's on OCPs, there are certain drugs that they cannot take with those. Acetaminophen, I know that's surprising, anticoagulants, and some anticonvulsants. Anticonvulsants, what is that? Seizure medicines, okay? So phenytoin, carbamazepine, can't get it out, primidone, and topiramate. They reduce the efficacy of the OCP. So you need to make sure to let your patients know. And a lot of antibiotics do that. I had a cousin that got pregnant while she was on an antibiotic, and she was on birth control pills. And so I have another little cousin because of that. So it's not foolproof. Contraindications. So why would we not prescribe or give the OCPs to the patients? Okay. We would not give them to anybody that smokes cigarettes and is at least 35 years of age. Uncontrolled hypertension, you can read on through here, but there's specific ones that we cannot give those to. Okay. It goes on to talk about some more. On page 50, let's look at page 50, and it's talking about the different intrauterine devices. So this is the there's different ones. They're called all kind of things. Mirena, there's different ones. Paragard, but this is progesterone. Okay, so it sits in your uterus. And it has a string. It's placed in there. It's kind of painful to be placed, but you place it in there, and it produces this estrogen all the time. The copper T is one that is like a long term. And sometimes people just get them because they have dysmenorrhea, painful periods. But this is the most effective birth control. Okay, so if you'll look at this right here, this is a wink and lollipop. Okay, So this IUDs are 99% effective, okay? So remember that. Wink a lollipop, okay? Alright, and that is it for chapter. There's another picture of the different clips. So let's talk about this real quick. One more thing before we end this chapter. Female sterilization. So, tubal ligations, okay? Getting your tubes tied. Bilateral tubal ligations or tying the tubes. So there's different types, okay? There's the ligature where they actually cut the tube and tie it. You can see that here. They clip it here. And this is for somebody that is really not sure. They just think they don't want to have kids, but they may want to have it reversed one day. They'll use this one. And then this one is where they tie it. And sometimes this can slip off. So if you want pretty much 100% infertility, you get them cut and tied. Okay? Or hysterectomy. I mean, that's another alternative, right? So, okay. So that is it for chapter 2.